If evenings are becoming more unsettled, confusing or distressing for someone living with dementia, you're not alone. I'm Cleary. I've worked in the health and social care industry for over 25 years, supporting families and training caregivers in dementia care. In this video, you'll learn what sundowning is, why evenings can feel harder, and practical steps you can take during the day and in the moment to reduce distress. Sundowning is a term used to describe changes that can happen later in the day or into the evening, particularly for people living with dementia. That might look like increased confusion, restlessness, anxiety, agitation, or a stronger need to move around. For some people it builds gradually as the day goes on. For others it can feel like a sudden shift once late afternoon or evening arrives. There isn't one single cause of sundowning. Often it's a combination of things building up over the day. People may be more tired, their energy is lower, the light changes outside, which can make rooms feel unfamiliar or confusing. There may also be unmet needs like hunger, thirst, pain, or needing to use the toilet. When all of that comes together, evenings can feel overwhelming. It's also important to say that not every change in the evening is automatically sundowning. You don't need a formal diagnosis to notice when something feels different or out of character. If behaviour changes suddenly, is more intense than usual, or doesn't follow a familiar pattern, it's important to pause and consider other possible causes. That might include pain, infection, side effects from medication, poor sleep, or feeling unwell in some other way. In those situations, it's important to speak to a GP or healthcare professional, especially if the change is new or worrying. Sundowning often follows patterns. Paying attention to when it starts and what the day has looked like beforehand and what seems to make it worse can be really helpful. That's because it gives you clues about what's contributing to the distress and where small changes might reduce pressure before the evening arrives. It might be linked to things like mealtimes, naps, noise, visitors, lighting, or changes to routine. One of the most helpful things you can do is think about the whole day, not just what happens in the evening. When someone is living with dementia, tiredness and overstimulation can build up gradually, even if things seem fine at the time. A steady routine, gentle activity and exposure to daylight earlier in the day can help regulate energy levels and reduce restlessness later on. Where possible, it can also help to avoid packing too much into the late afternoon and to keep naps earlier and shorter so that they don't interfere with the evening. As the day moves towards evening, changes in light, noise and activity can make the environment feel unfamiliar or overwhelming for someone with dementia. Small, predictable changes help because they reduce the amount of information the brain has to process at a time. That might mean softening the lighting to avoid shadows, closing curtains to reduce reflections, and turning down background noise so there's less competing stimulation. Keeping things familiar and following a similar routine each evening can help the person feel more oriented and secure, which in turn can reduce confusion and anxiety. If sundowning does happen, it can help to focus first on how the situation feels rather than trying to solve it straight away. Keeping your own approach calm and steady can help lower the overall level of stress. Speaking slowly, using fewer words, and reassuring through your tone can be easier to process than explanations or instructions. Checking simple needs like whether the person is thirsty, hungry, in pain, or needs the toilet can also help reduce distress. If it feels appropriate, gently shifting attention to something familiar or soothing can sometimes help the moment pass. If sundowning is happening regularly, becomes more intense, or raising concerns about safety, it's important to ask for support. That might be from a care manager, a GP, or another healthcare professional who knows the person well. Getting support early can help you understand what's going on and reduce pressure on everyone involved. Sundowning can feel exhausting and unpredictable, especially when evenings become consistently harder. But understanding why it happens, looking at the whole day, and making small, steady adjustments can reduce pressure over time. You don't have to get everything perfect. Even small changes in routine, environment, or response can make a meaningful difference. This video is part of a short series looking at practical ways to support someone living with dementia. And if there's something you're unsure about, you're welcome to leave a question in the comments.